we have seen recently in Kota as well. There have been huge number of suicides.
in movies or in like various media, that there's a kind of a suicide being used to like emotionally blackmail or threaten someone.
So just put in a word,
Right.
भाई क्या हुआ है? अच्छा है? Just one word can actually do a lot of difference,
Yeah.
Vishnu.
So, hello everybody. Today, our podcast, our health cast, is on a topic that is not only quite the rage right now in the media space, but also something that is very close to all of our hearts. We, as students, at some point of our lives, have been through a lot of stress, but like luckily, we have been through that and we have come out of it quite well. But there are obviously cases which we have been seeing that like there's a lot of rise in suicides at this moment through time, and also especially coming in so much of a news. It's really heartbreaking to say the least, but also we need to take a deep dive in to introspect within ourselves on how to prevent it, and also to know about the mental health space, not only to prevent it for others but also to know the signs and symptoms that might even happen for us as well. So today I have with me a very good friend of mine, somebody whom I have known for since a good part of a decade, Dr. Madhu Vamsi, who's been like a really eminent psychiatrist, not only in the space of academics but also so much in the space of public health point of view. He's been conducting a lot of camps in educational institutions and also in the workplace sector. With that, like as I just told you, this is the place where there's a lot of stress going on, and also there's the most risk of self harm or suicide, which we may say. So, hello, Madhu, how are you? Oh, hello, Vamsi.
Hi Vishnu, thank you for having me in HealthCast. I've been waiting to do something with Vishnu and his team. I think it will be a great opportunity for me, and I'm looking forward for this session, Vishnu.
Today our basic topic is not only on the point not only on the point of self harm, but also we'll be focusing more upon the student's perspective from this viewpoint, and also from a caretaker's perspective, because student obviously is at such a tender age that even if this video reaches out to him, he might not actually understand and might be aware. But more so for caregivers, for teachers, for educators, for friends, this is for everybody who might either himself or as a bystander be in contact of any person who is at risk. So Vamsi, like me personally, I've like being from an educational institution who basically has a lot of type A personalities, which I can say has seen quite a few suicides, actually quite closely as well, at least 3 4 suicides who have been like quite close to me. And also there's been obviously a lot of self harm issues, and at least like 20 to 30 suicides through my 6 years at AIMS. So this is one thing that kind of a lot of times surprised me, because like the prevalence itself is so high that I never imagined it to be so prevalent, and like in 6 years I'll see so many incidents. And also I'm like, that is my first question, like how much is the prevalence, and also like especially when it comes to students, like what are the stressors, why is it high in students, and is there a discrepancy between medical students and engineering students? So how does this whole thing of prevalence stand up in this point?
So, Vishnu, basically, it is about perceived stress. So, a person might be having a stress which others might think it's of not much stress to others, but this can lead to further stress in that person, where you might think it's a small thing. अरे ये तो छोटा ही है. Why is he so worried about it? But for that person, it can be something very high. Uh, so perceived stress is one of the major risk factor, and also leading cause for persons causing leading to suicide. Coming to the prevalence, it is around 7 lakh uh, individuals die every year because of suicide worldwide. And in India, the although the percentage might not show in higher rate because they're not coming up in our newspapers or in
They might not be
record
reported.
reported. So it will be difficult for us to actually gauge how much is the percentage in India. But like said and done, in the current state of social media, current state of newspapers, and we have seen recently in Kota as well, there have been huge number of suicides, especially among students who are in this age group of 15 to 18 or 15 to 19 years. But there's no study which shows that it is higher in the medical group. uh, it is equally there among medical students, IIT students, engineering students, and other faculty students. But it is more in the physicians. Among the doctors, if you see, it's more among the physicians
When
and
compared to
the
surgeons.
surgeons, and also when you compare to other occupations, a person from engineering background or other background who is working, who is in a
Yeah.
software engineer, etc.,
Right.
is not so much as compared to physicians. There might be stressors like long working hours and that erratic working hours of long night duties
Yeah.
or not having good personal life, etc. Uh, but uh, uh, but prevalence still is rising, and one good thing may be that things are coming out now, and but it's again double-edged sword. There are other cases where people are also leading to further stress. So as stress is further increasing number of suicides. So it's more like a double-edged sword where it's coming out in the open, but also stress is further increasing and also further increasing the amount of suicides.
Right.
Right.
Yeah, speaking of coming out in the open, like to be honest, like I've been a happy person most of my life, but at the same time there will be some like phases where you might actually be really low. Although obviously there's a difference between suicidal ideation and suicidal intent, which also I would like you to explain to our viewers. So everybody has something, maybe a like speck of a suicidal ideation, or sometimes even some people might have an intent. But the what is more important is like how do you identify these warning signs, like warning signals, not only in a like a friend or a student from a teacher's point of view, but sometimes even it might be difficult for oneself himself to understand that okay, this is how I'm feeling, or I might actually be at risk. Like we as medical students might still understand, but when it comes to like people from other fields, they might not really understand that they themselves are right now at a risk of something like a self harm. So my main question was that how do you identify these warning signals or warning signs, and then we'll come to the next question on how to tackle them. So like my right now
Correct.
would be how do you identify this in yourself and also from a sidewards perspective.
Correct. Uh, right, Vishnu. You have mentioned a very good point about suicidal ideation, intent, or plan. So basically, it's like active suicidal ideation versus a passive suicidal ideation, where a person might have this certain death wishes. We see usually old people like, okay, I'm done with my life, let God take me away, or let those are something like ideations or wishes or death wishes which just keep happening. It can happen any person, more so in the older age group, it happens where they feel that a sense of completement in their life, but
Right.
that might change into a plan where it is called as active suicidal ideation. So a person might change from passive suicide to active suicide where he actually plans. Actually plans to get all the required items. He might end up buying a firearm. He might end
Like
up buying a
googling
rope,
or like
googling stuff, and more so in our profession, they tend to take up medications as it is
right.
easier for them to get, especially anesthetic medications or other kind of medications.
Yeah.
So that is the plan. So and you usually see them, you see in their Google chat history or somewhere writing down in their books or in the WhatsApps. There's something called WhatsApp you, where you text yourself,
Okay.
which has recently been seen in many in our WhatsApp. It's a new feature where
Okay.
people tend to write themselves. So
Yeah.
we see a lot of those messages coming up there, and police are nowadays seeing the first message is that itself. So where they
Okay.
try to talk to themselves and they're seeing that thing happening, planning themselves.
Hmm.
And out of 100 ideations, only 30% end up becoming plans. And out
Okay.
of all the plans, 30% of the plans, only 50% end up becoming attempts.
Okay.
So we still have a lot of ground to clear. So if
Right.
out of 100 people, still 15 to 20 people will end up having an attempt of
Yeah.
suicide.
Right.
So that's quite a huge number. So
Yeah.
even if you have, if somebody has having an ideation, we should not just take it granted or take it something. Okay, just
Lightly.
an ideation is just lightly. So I believe that's a good chunk and extremely threatening also.
Right.
Okay. Now coming to the warning signals. Usually, in my experience, Vishnu, we get a lot of patients in our OP, especially poisoning patients for counseling. It's mandatory that they come for counseling, especially after during the stay or almost prior to getting discharged. So there we see something like they have been in the state of chronic mental illness, say depression or anxiety or some kinds of schizophrenia also. So we should not ignore any kind of mental illness, first thing. So even if he's slightly depressed, just go and take him to the doctor, go and take him to the psychiatrist or a counselor. So just so that they can assess. So warning signal, first warning signal is chronic mental illness which has been there since a long time. Second is usually change in their sleeping habits or appetite, where they usually stop sleeping for long hours, take long hours to sleep, and slowly they get aloof from their friends. So after a point, they start to get away and try to be alone in their room. So if your friends or if your family members see there's some change in him recently, he's not the person like we have seen him.
Right.
Like usually we tend to
Yeah.
know our
Get a
friends,
feeling.
right?
Yeah.
You get a feeling that अरे कुछ
There's
कुछ तो
something.
बात है. He's not
Something. Yeah.
something. Yeah, he's not talking to us. So just put in a word.
Right.
भाई क्या हुआ है? अच्छा है? Just one word can actually do a lot of difference,
Yeah.
Vishnu. Just
Like he can
one
just
word of
feel that somebody is caring for me, and like
caring for you.
Yeah.
Yeah. He might not tell you anything. Like
Yeah.
he might like, no, no, everything is fine.
Yeah.
But that one word itself of that affection, okay, somebody is still there.
Yeah.
So that will actually uh, stop him from taking that drastic
Yeah.
step.
Right. Yeah.
So,
Like I.
so
Yeah.
right. So that is another thing where people tend to go get away from their usual life. So that is one of their warning signals. Right.
Right.
So uh, the first warning signal for me will always remain change from their normal routine,
Usual. Yeah.
usual routine. Yeah, we have certain cases where they can be drastic or sudden, where it can be because of a random breakup or because of getting less marks, which is drastic and which is
And like a
spontaneous.
trigger, it can act and
Trigger,
then suddenly
trigger.
change things.
Yeah,
Yeah.
yeah. But that percentage is not that much.
Okay.
If you actually see, he'll be having some kind of illness,
Chronic issue would be there most
chronic
of the
issue, and
times.
this trigger will further add up,
Precipitate that. Yeah.
precipitate that.
Okay.
So that's the major thing. Yeah.
Right. So yeah, like as you said, my next question was that like we see sometimes that we might be looking through somebody's WhatsApp or just scrolling Instagram, and then you just see that kind of, for you it might actually seem disturbing, but for the person involved, he might actually be trying to like give out a call for help or give out a SOS signal sort of thing, give a like put up a status which looks very depressing, or even put up as suicidal ideation kind of status. So you as a bystander, or as a sometimes as a friend, or even sometimes as a random person who looks at, by chance you come across a social status, media status whom where you're following the person. So how, what should be your next immediate step, and also how do you deal with that? Like obviously we our intention would be to try and comfort him or her, but how
Right,
should we actually proceed? There's a lot of dilemma here. So
right.
what would you say?
So, Vishnu, we see certain people trying to put in messages we see in on social media, or they can call one of their friend and talk that they're not feeling well. The only way here is initial step is here is just go and talk, or let him talk. Just ask him how you are or what's wrong,
Right,
and you don't have to answer him anything.
right,
But just the fact that he ventilates himself will actually decrease his suicidal thoughts or suicidal ideations, and his drastic step of taking an attempt. So just go and talk. If you're not around, tell your friend to go or tell their family member to go. And I want specifically that if somebody is planning to commit a suicide or having some kind of ideation, I don't want somebody to scold them or tell them you're wrong,
right,
because doing a suicide is actually quite drastic. It takes a lot of courage and a lot of despair and depression also to do that.
right,
So I just want a person to be empathetic
right.
and at the same time non-judgmental.
Yeah,
It can be any random reason. Just
yeah.
go there, talk for a
At
second.
least
You
that
just
judgment is not what he or her needs at that moment, at least.
correct.
Yeah,
So I want them to do that. So empathy, non-judgmentalness, and making sure somebody talks to him.
right,
It can be a friend. If you're not around, tell another friend to go or ask their family member to go. But
right,
make sure somebody is around.
right,
And we tell a lot of our patients who are having these suicidal thoughts to make sure that they're not alone.
right,
Make sure somebody's around. At least a kid is around, or at least grandmother is around, grandfather is around, so that it just make sure that those thoughts don't creep in and he suddenly does something out of the moment. Correct.
So yeah, like we've been talking a lot of empathetically about suicide and self-harm, but there's this gray area that sometimes happens. Again, I'd like you to elaborate, and I would want you to advise us on how to deal with this concept of threatening suicide, or like versus non-threatening suicide. Like as we've seen in maybe even personal instances, or even in movies, or in like various media, that there's a kind of a suicide being used to like emotionally blackmail or threaten someone. Like, although the feeling might be there, but it's used as a weightage or a leverage to gain something, right? So like, what is threatening suicide, how to deal with it, how is it different from non-threatening suicide, and also how to identify lethality, or the danger, actual danger in a suicidal individual.
Correct. So, Vishnu, in suicide, we actually see two kinds. One is threatening type and a non-threatening type. Threatening type are the ones who usually tend to have this parasuicidal cuts on their arms, who constantly cut their arms or uh, put a blade and on their arms or in their uh, head. So, but the thing is, threatening or non-threatening, suicide itself is something drastic and which is important. So, a person who keeps on threatening and wants to do a suicide, it might not be as lethal as something which is non-threatening or which is out of chronic psychiatric illness or something which is happening since quite some time. And we tend to take things lightly. अरे ये तो हरगिज बोल रहा है, he
Got
wants to die. So we tend to take things lightly. But I want to be specific and in quote unquote say that threatening or non-threatening, it can still lead to a death of a person
Right.
at any point. Even if it's a small thing, it can at any point end up being a larger thing, and it might lead to death of the person. So although I've told the difference, but I want to make sure that it doesn't matter. That itself is huge. And coming to lethality, so lethality is where something like you drink a bottle of poison and a person drinks a, a chammach or a spoon of poison. So he might think as just a spoon of poison, it doesn't matter. It's not lethal or thing. But we don't know. The poison can be something which is so lethal that even a spoon can be causing danger to him. So we have to make sure that what is the lethality thing? Does he think the whole bottle or just a spoon? Or did he do it out of thinking that, or it's just a spoon, nothing will happen. I'll make sure that my family gets back to me or does something to me or just I threaten to them. So I want to make sure that lethality matters, but end of the day, any kind of suicide is something dangerous, and I want everybody to keep a watch on it.
So even if somebody is threatening you, so even if you feel that he's just using it as a leverage, please don't ignore that. Please don't go in that direction. Again, as we already discussed, that is not the moment to be judgmental. Yes, I agree. You can give him or her your advice that like this should be the way to do it. Don't think this way, but we can wait for that. Not at that moment, at least. That is one
Benefit
moment,
of
or
doubt.
yeah, we should always give the benefit of doubt to that person even if you feel it is a threatening one. And obviously there's a lot of situations that come about, but at the end of the day, baseline, our advice would be to give him or her the benefit of doubt, because threatening or non-threatening, it is still at a risk for a self-harm or a suicide. So yeah,
Correct.
also lastly, coming to, as we all always discuss on our health casts, our solution or our main baseline advice on how a person himself, oneself, or for a colleague or a like who's staying with you, or your child or any like student, like how do you make him or her less prone to suicide, or in putting it another way, how can one make himself less prone to feeling of depression? How can he or her decrease his own risk of suicidal tendency?
Correct. So, Vishnu, I have only one thing. Having one confidant or one good friend or one good family member where you can share anything without having that fear of being judged or being have fear of being answerable to anyone. So even usually, why do suicides happen? Because out of guilt, out of hopelessness, helplessness, out of they, they don't see any worth of themselves. So, but if you have one friend or one family member or cousin or anybody, so that will really help them to not to go up to an extent of committing a suicide or attempting a suicide. So one friend will make sure that he doesn't go to up to that extent, and he'll make sure that he seeks help because he is the one trusted by the person who's committing a suicide or attempting a suicide. So if he seems some kind of depressive event or some kind of low mood or some kind of drastic changes in his activities or anxiety, or for that matter something psychotic like commanding hallucinations, where he says, I'm listening something where people are telling me to die. So those can happen. That's like 1% of a population.
Yeah.
So out of 100, 1% might actually end up doing because of commanding hallucinations.
Yeah.
So so having one confidant or one friend is most important protective factor. Okay. And second thing, uh, acknowledging it and having the awareness that something like this can happen. Something like many people don't know that schizophrenics can end up committing a suicide or attempting a suicide. Or we mostly talk about depression, but there are a lot of other cases where a person with borderline personality or emotionally unstable personality end up having a sudden trigger and end up attempting a suicide. So having the awareness that there are a lot of people who can actually end up committing a suicide or attempting suicide. For example, we have a lot of chronic illness patients, Vishnu. Like I know you are also part of rheumatology, illness such as cancer, such as fibromyalgia, chronic pains. They go up to an extent they feel, array, there's no point in living.
Yeah.
I mean, there's secondary depression occurring to it, but
Yeah, yeah. It's
yeah,
very common
those are
actually
certain,
among, especially
there
among
are
rheumat.
certain,
Yeah.
yeah. So, so there's, I want to make sure that there's certain risk individuals like chronic illness patients
Yeah.
or who are having a family history.
Yeah.
Usually, it's easier for a person to attempt to suicide because there's somebody else in the family who had crossed the threshold.
Yeah.
It's just like addiction, Vishnu.
Yeah.
Somebody in the family does, so it's easier for other person to do.
Right.
So that threshold is there. So and also history of previous suicide.
Right.
So
Attempt.
we are attempt previous suicide attempt.
Yeah.
So I want people to watch these risk factors and also what are the protective factors. Having a confidant, having a friend, and then acknowledging it and trying to talk about it, and having the knowledge about who can do it.
Right.
So these are the few things I want people to understand, take care, and also empathy and non-judgmentalness will actually make things much better in the world, Vishnu.
Right. Definitely. So on this very positive note, we'll take leave here. It was really enlightening for me, especially some doubts which I had, especially on how to deal with somebody who is seems to be at risk. This is something I personally would obviously want to be very thoroughly knowledgeable about, and you explained it really well. And also, sometimes it's very difficult to immediately take care or immediately recollect on how to deal with it, especially if somebody of like a close one or something, where you might have your own personal connection, and you might have your own ways of dealing with it. But again, you've taught us professionally on how to handle these situations. It was an amazing session, this one, a very emotional one, obviously. uh, you know uh, we've all been through a lot of ups and downs, and we've seen in whatever extent, whatever measure, suicides happening in our workplace or educational institutions, as we discussed through this podcast, or sometimes in our family, near or far. So this is a very close topic to all of us, and you really taught us really well. It was an amazing session. So if I hope you loved it as well. So with
Thank you,
that,
Vishnu.
yeah, with that, we'll take leave, and we'll meet you in the next healthcast.